So my presentation is about establishing a dedicated pediatric immunology service within a pediatric cancer and blood disorder center of Armenia. Immunology touches many pediatric subspecialties. It takes a reliable place for the diagnosis and treatment of oncohematological diseases. Primary immunodeficiencies are genetic disorders that predispose patients to frequent malignancies and are often associated with hematological diseases. Secondary immunodeficiencies may also be induced by oncohematological diseases and their treatments. Armenia's population is estimated at about 3 million, of which 700,000 are children. Many patients are underdiagnosed in Armenia, and most of them go abroad. So we aim to establish a dedicated immunology service in the structure of the Pediatric Cancer and Blood Disorder Center of Armenia. An Excel-based registry was created, and within 10 months, 26 patients were recruited. A twinning program was commenced with French-Armenian medical group with the purpose to discuss difficult cases with colleagues from the leading French centers, standardization of data collection forms, and establishment of laboratory service. A multidisciplinary team with a clinical immunologist, genetics specialist, infectious disease specialist, nurse, and program coordinator will be created. A bone marrow transplantation unit, palliative care, and psychosocial services will be the part of our service. Establishing a pediatric immunology department in a resource-limited setting can present a number of challenges. Limited financial resources pose significant hurdles in the setting up of department. One of the primary obstacles is the lack of necessary equipment and resources required to perform diagnostics and treatments on pediatric patients. Another difficulty lies in the storage of adequately trained personnel with expertise in pediatric immunology. A lack of public awareness and education surrounding pediatric immunology may hinder the department's ability to establish itself and thrive. Furthermore, the distribution and availability of medicines, vaccines, and other essential treatments can also be a challenge, as they may be scarce or unaffordable. Despite these obstacles, establishing a pediatric immunology service in a resource-limited setting can have a significant positive impact on the health and well-being of children in Armenia. It is essential that stakeholders work together to overcome these challenges and ensure that all children have access to quality healthcare services. The establishment of the Pediatric Immunology Department in Armenia is planned for 2024. This will lead to a substantial modification of the center. The achievements in the treatment of oncohematological diseases are related to the achievements in immunology. And thank you very much for your attention. Your present